Namaste all, myself Dr.Remya Krishnan, faculty and clinician of Ayurveda. Nowadays we are seeing in newspapers many cardiac deaths. The cardiac deaths are too common these days. That too youngsters are dying. Mostly people starting from recently I have seen even 13 years old children and 15 years old children dying by heart attack. I have seen several authentic reports and I have seen news reports also. So I was wondering even why these cardiac deaths are so common these days. So the most common cause which is identified for cardiac death nowadays is it is written as cardiac arrest. So sudden cardiac arrest is happening in children, previously healthy people, which means that there is an alarming cause behind that. So this made me create this video, and it is not, frankly, it's not a video intended to defame a medical system. This I want to make clear very specifically, and my point of this video is not objecting a medical system or blindly criticizing a medical system or an intervention, but being a doctor who is concerned of the health of the people, my video is intended to create public awareness regarding the possibilities of very common cardiac deaths today. I have been analyzing this for a couple of weeks, or I would say months, because it is too common. So we know that cardiac deaths, sudden cardiac deaths are happening mainly by either by cardiac arrest or by heart attack. Cardiac arrest is a condition which is entirely different from heart attack. Cardiac arrest, as we know, is the abrupt loss of cardiac function, breathing, and consciousness. It results from a problem with your electrical system of the heart, conducting system of the heart. And when the conduction of the heart is impaired, it can damage the pumping action of the heart. We know that heart is the main organ which is pumping blood to all parts of the body. So this pumping action is also stopped, and your body, other parts of the body are not getting enough oxygen. Oxygen is attained through blood circulation. So when blood circulation is not happening properly, oxygen will not be reaching all the body tissues. But what is heart attack? Heart attack is different from cardiac arrest. Heart attack is an occlusion of the coronary arteries which supply heart. The arteries which supply heart, if there is an occlusion happening, it can be by means of clot formation, it can be by narrowing of the lumen of the artery or the space of the artery, whatever it is. There is constriction of blood vessel. It can happen by any cause. So all of a sudden it can develop, or it can develop eventually also by a very erroneous lifestyle. Heart attack is not born in a day. By very long sedentary lifestyle without any physical activity or eating heavily, or so many causes are there. I have posted it in my Facebook post. Those who are interested may refer my Facebook post on heart attack. In that you will find the reasons for heart attack. Finally, the occlusion of the coronary artery which supplies heart is happening, and it can sometimes, this heart attack can also trigger an electrical imbalance that can cause a cardiac arrest. But the problem is that nowadays healthy people are dying. So abrupt loss of life, if at all happening, in the logical perspective of Ayurveda, we should be considered first cause or immediate cause as visha only, toxin only. So it is very sure that one unusual toxin is reaching the human system, which is responsible for this abrupt death or abrupt loss of cardiac function, abrupt stoppage of breathing, and abrupt loss of consciousness. So we have to suspect visha, and visha can be attained from external things like through food or medication or water, whatever it is. And it can also be formed inside the body. Like in Ayurveda, there is a reference, Viruddha Adhyashana Ajirna Shilino Vishalakshana. So those who are practicing incompatible things, people generally think that fish and milk eating together, or any such two things which are contradictory, honey and hot water, like that people think that two substances which are contradictory to each other, when they are taken inside, it is what is called incompatibility. But that is not enough. That is only one aspect of incompatibility. Incompatibility can happen between the status of your body and the nature of interaction with the things you take in as food, or you interact with through your sense organs. It can be anything incompatible. Like, for example, you are having a autoimmune disease. Your immune system is attacking yourself, any some organ or tissues. You are taking some medication which is having toxins in it. Okay, any sort of medication, it's not necessary that it contains toxins, but the nature of that medication, when it becomes incompatible to your body status, it toxicity is generated within the body. Like, for example, when you are having an inflammatory disease, you are doing a bath, or you are applying oil on your body. You are applying oil. Inflammation means it is a localized fever. Fever is generalized inflammation. So in an inflammatory status, if you have decided to apply oil or take bath, that is also incompatibility. You have decided to sleep in the daytime during inflammatory status, that is also an example for incompatibility. So in a disease status, let it be immune disorder, let it be metabolic, let it be circulatory, let it be hormonal, whatever it is, there we should be verifying the degree of compatibility between the things that we recommend as physician and the state and stage of the patient. On the whole, Ayurveda is a holistic science. Ayurveda does not mention treatments for heart. There are treatments mentioned for heart, but if a cardiac patient comes, we are not supposed to treat by heart medications alone, or sometimes we need not treat by heart medications which are mentioned in the context of heart disease. We have to explore the patient and find out why this patient developed this. Suppose arrhythmia developed in a patient, we have to find out we have to explore the history of the patient, and we have to find out why this patient has developed this arrhythmia, from his diet and regimen, medication history, everything. So, what I mean is that incompatibility can generate toxicity. Viruddha adhyasana, excess eating, or before the previous meal gets digested, again if the person is eating, that is called adhyasana. Nowadays, there is a very common habit that people are continuously eating, considering nourishment. People are eating continuously in small proportion. Even doctors are promoting that, especially in the times of pregnancy and all, after delivery, etc. This is a very dangerous habit. Before the digestion of the previously consumed food, again if you are taking in food, it can cause toxicity in your cells. May not be that you will die in the next day or next hour. There are two kinds of toxicity: immediate, as well as it will stay latent in your tissues, and it can cause toxicity generated or toxicity induced diseases. There are so many toxicity induced diseases. Toxin as such will cause malfunction of the immune system. That is the main problem. So inflammation is an immune disorder. Okay, so even toxicity can cause, it can adversely affect the immune system. It can adversely affect, toxins can adversely affect the metabolism, cellular metabolism. Healthy cellular metabolism is important for oxidation, oxygenation, energy production, etc. So when it is not happening, impaired metabolism, it can cause so many different diseases. It can, immune dysfunction can cause allergies, autoimmune diseases, and to a high level it can cause cancer, etc. So this artificial immunization, Nowadays, one major difference compared to before is undoubtedly it is COVID vaccine. So this COVID vaccine, after this COVID vaccine, people have started taking too many like very health conscious people, so they want to get out of this fear of corona. So many people have resorted themselves to COVID vaccination. It's really important that before introducing vaccination, people should be conscious about the information given regarding the vaccination. But people are least bothered about the information given along with the vaccines, like COVID vaccine. What are the risk for the COVID vaccine? If it is your body, when you are buying a shampoo, you will be checking what all side effects are there for that. But the same yourself, not checking when you are going to resort yourself to a medication. Why it is happening? It is a very strong thing to contemplate, because we are very much health conscious. We will be thinking of everything. We will be checking the packets, everything what we buy regarding the chemical side effects, everything. But while going for this purpose, while going to see a doctor, or while going for vaccination without seeing a doctor, or with seeing the doctor also, you are surrendering your intelligence and consciousness to that procedure. Instead of working on yourself, instead of researching on by yourself what all risks are there for this vaccine. So it can cause visha, means actually it is a toxin only. There are so many toxins inside this artificial vaccine. So these toxins can definitely cause an adverse impact in your tissues. We cannot say exactly whether it will be resulting in immune dysfunction, or whether it will be resulting in metabolic dysfunction, or whether it will be suddenly causing stoppage of breathing and abrupt loss of cardiac function and consciousness. Because in Ayurveda, prana ayatanas are mentioned. Prana means oxygen. So prana ayatanas, the main seats of prana. There are 10 prana ayatanas. Dashajivida dhamani, shiro rasana bandhanam, kandha asro hridayam nabhir, vastir shukraujasi gudam. So in that, main two things are, one is immune system, second is heart, hridaya. So this visha, it can cause, as it is hridaya is a prana ayadana, seat of prana, it can directly afflict hridaya. So once it is directly afflicting hridaya, visha is, if that fatality is more, it can definitely cause abrupt loss of cardiac function immediately or later, because it will be staying latent in the tissues. That is the main property of these vaccines. It will be staying latent in your tissues, body tissues, without any clinical symptoms or anything. You may think that the vaccine side effect period is over, nothing will happen now. It's not like that. It will be, toxins will be always staying deep inside the tissues. So if you are doing nothing to neutralize them, or if you are not stimulating your metabolism, you don't know what to do to neutralize their effect. You don't know how to create your immune system in favor of yourself. You are always exposed to the danger. No matter how much healthy you are, your lipids are normal, your BP is normal, your cholesterol is normal, your sugar is normal, either artificially or naturally. Then if it is artificially done, it is not called normal, it is suppressed. Whatever it is, don't think that you are healthy, because nowadays we are seeing so many people who are having sudden heart attacks, sudden hypertension, sudden allergy. I have recently seen, I have shared the case in Facebook also, a person who developed sudden bleeding on his face, healthy person who was not having any other problem. So why these sudden symptoms? Sudden symptoms indicate toxicity. This toxicity, so, but these people might have been vaccinated long before, sometimes before weeks or months. But what I mean to say is that these toxins are staying latent in the tissues, and we are, people, public do not know what to do. to neutralize or deactivate these toxins from their cells. General things, basic things. So what happens is, as they are, it can affect hridaya or ojas means immune system can derange. Sometimes it depends on what kind of disease you are prone to get. Okay, every person, it is not like same kind of dysfunction can happen. Some people will be prone to develop anemia, some people will be prone to develop increased platelet count or decreased platelet count. Some people will be prone to develop metabolic disorder. Some people, it will be causing sudden loss of consciousness, and cardiac affliction can happen, because heart and brain, when it afflicts seriously, immediate death can happen. So these are the problems. We cannot exactly assess in ourselves whether I am prone to get any sort of abnormalities in future. This is not like, as I told, not for 1 month or 2 months. After 1 year, now we know that vaccine was introduced in 2021, but now also people are getting now it is more, I feel so many reports are coming. So it is not like I am safe now, the period is over, nothing like that. We are always, those who have taken resorted to this are always so much risks are there for them to develop any sort of dysfunction. It's not, it need not be cardiac deaths. Doesn't matter whether a person dies by cardiac disease or metabolic disease or immune disease. Nothing should happen, right? So for that, what to do? We cannot say exactly that by doing this, this toxicity will be alleviated, but we can do certain things to make sure that our drainage system, internal drainage system, it's not like when you are evacuating your bowel and bladder you are safe. It's not like that. There is something called internal drainage system inside your cells. Metabolism should be very good, circulation should be healthy, drainage from the cells to the excretory organs, that should be proper. For that, there should not be any sort of impairment happening to these functions. Okay, so for that, number one, you have to drink boiled water. Boiled water, don't drink unboiled water. Unboiled water is always, according to Ayurvedic science, it is heavy to digest and metabolize, so it has got a high risk to develop these immune dysfunction. It's not that people when get adapted to drinking it, it's not necessary that it causes some sudden problems, but when there is an environment inside the body to trigger an inflammation, or when there is an inflammation, if you are drinking, or when there is arrhythmia, abnormality in the conduction of the heart has developed by some toxins, and you are continuously drinking unboiled water, or you are using additives, number one, additives, any sort of additives, can be any sort, need not be smoking alone, it can be alcohol, smoking, any sort of new generation additives are equally dangerous. Even unboiled water or water boiled with insensible medications, like sometimes spices people are boiling in water, like turmeric, what you call lavanga, clove buds, so many things nowadays, it's very very dangerous going. So without a scientific advice, if you are putting some herb or spice, listening to someone, boiled water, that can also cause sudden constriction of blood vessels. Like, for example, this turmeric powder in water boiled and drinking, it is different from turmeric powder 2-3 pinches in curry. It can cause sudden constriction of blood vessels. Okay, the same effect as when you are running or when you are engaged in a physical activity, adrenaline is secreted and your blood vessels can constrict. Same thing can happen by intake of too many spices like turmeric, pepper, then what you call tulsi, etc. It's not fair, or it's not sensible to use these things daily as drinking water. That's what I meant. So this culture has to be stopped. This is very common in India, and all the medications, we don't know what kind of interaction is happening between these medications and the vaccine. We don't know. There is no research going on like that, in my understanding. If anybody has seen anything, please share that. So we cannot say what kind of drug interaction can happen between this toxin which is induced into the body and the nature of drugs taken. Okay, so that is one point. So generally, cardiac arrest develops by myocardial infarction. People who are getting myocardial infarction, scarring of heart, thickened heart muscles like cardiomyopathy like cases, sometimes diuretics which can lead to loss of magnesium and potassium. They can also cause abnormal rhythms in the heart. Sometimes blood vessel abnormalities also can cause. But now we know that people who are dying these days do not have any such problem. They are dying abruptly. They are all healthy people. But then why it is happening? So in order to prevent that, drink boiled water, keep yourself active, physical activity. In empty stomach, you have to do exercise, and the best exercise is brisk walking or stair climbing exercise for healthy people. Okay, those who are not having any fever or inflammation or in any part of the body, best exercise is stair climbing or brisk walking and not the postural exercises. Okay, this will improve the cardiac circulation all over the body, and also it will stimulate the metabolism. So this is number 2. And number 3, boost your hunger. Don't eat when you are not hungry. You eat only when you are hungry. If you are not hungry, you don't eat. You stimulate your hunger by sipping hot water. Stimulate your hunger. Then, when you feel hungry, you eat light. Very important. Don't fill your stomach fully. Especially those people who are vaccinated. Take care that your digestion is very good. You maintain a very good digestion, because when your digestion is maintained properly, your metabolism will also improve. So eat only light food. Light food is not ulundu vada or fried things are not light, cutlet or something. Light food means gruel or fulkas. Instead of eating a heavy paratha, change to fulkas for some period, or at least disciplined diet for 1 week every 30 days. Disciplined diet, this kind of diet, 1 week every 30 days, make sure that you are following. And also, all these things are very important. This drainage mechanism, internal drainage mechanism, will also improve by drinking boiled water and maintaining very good physical activity. You have to do exercise in the empty stomach only. Don't do exercise after food. This is very important, because many people are exercising after food. Even brisk walking after food is dangerous to your heart. It is because we know that heart has to pump for digestion. Heart has to pump, and along with that, when you are doing some intense physical activity, then your heart has to pump more efficiently for the blood to reach every parts of your body. So make sure that you are doing 10 to 15 minutes minimum physical activity in empty stomach. It is called as exercise only when you do in empty stomach. And suppose you are getting some one sudden morning you are not feeling good. You may not be able to explain how you are not feeling good. You don't have any fever or anything, but you are feeling lethargy, weakness. You are feeling body pain, heaviness, and there is no energy for you. Okay, there is no energy for you, and your bowel movement can be distracted. Sometimes it may not be normal, sometimes it may be normal, and you feel to lie down most of the time. You must understand that it could be a cause of inflammation in your body or infection in your body. It's not that it may not be evident as a fever or something. So if you are not able to overcome this infection or inflammation, it can cause abnormal changes in metabolism, circulation, immune status, drainage mechanisms. We cannot say what it is going to impact in your body, and it can cause sudden death also. I'm not telling this to frighten you, but if you sense that your digestion is not proper, you're feeling weak, your energy level is low, and sometimes your heart rate may be low or high, and you don't get hunger on time, you are not getting easy bowel movement, and energy level is poor. So, all these indicate that you should be conscious. You should be boosting your hunger. You should be sipping hot water. You should not be lying down and sleeping. And you should wait and see whether you are improving yourself by doing this. And even when you notice that you are improving, don't stop eating light and eating right for the next 5 days. Make very sure that you are eating very light, your hunger is very stimulated. See, believe me, you will not die by malnutrition when you boost your hunger. I'm not asking you to not to take food and starve. I'm asking you to boost your hunger by light food and eating only when you are hungry. By doing this, your metabolism will improve, your circulation will improve, your immune system will get more efficient, your drainage mechanisms will be efficient, and you will be able to sometimes eliminate the toxin from your body yourself. Don't resort to any new medication or any panchakarma procedures or anything, because nowadays so many myths are there on Ayurveda, like vaccine poison can be removed by panchakarma, etc. It's a very stupid thing. Panchakarma is not removal of toxins and all. Please watch my panchakarma video in my YouTube channel. I'm explaining what panchakarma is meant for. It is not removal of toxins. Okay, so these things you should be aware of. Why I made this video? Because nowadays people are dying so much, and it is very, very disheartening to see youngsters dying. Okay, and when you are getting chest discomfort, shortness of breath, weakness, fast breathing, or something like that, something not well, don't wait to get the medical advice. Okay, so even scientific practitioners of Ayurveda will be able to save you by scientific first aid. SBBA is doing that only. We are teaching and training our doctors on scientific first aid, how to understand what is happening and how to instantaneously reverse the problem inside. So we are having such a strong science to understand and reverse the problems. So take care, stay healthy, and once you are adopting this first aid, which I am telling you, which I told you right now, you will be able to protect yourself not only by the toxin adverse effects, but also you will be having an efficient immune system, and you need not worry about any new sort of variants of virus or anything. You can lead a healthy and happy life, and just know that SBBA practitioners, we are always there at your service. There is a free first aid program called Hastalamba running for the past 2 years by SBBA professional community. You can visit in our website, or you can visit on Google SBBA Hastalamba VFFA. When you type, you will find it. It is a free service. You can avail the service whenever you are having any sort of infective fever. Any sort of infective fever, you can register on it, and our doctors will get back to you. Okay? Stay healthy, happy. Jai Hind.